ever-important World Oral Health Forum is taking place behind us. Let's go and find out how they're leading the way in improving oral health in the world.
We should take the Minamata Convention as an opportunity to rethink our way of treatment, opportunity for new research, opportunity for new approaches, and so I think it is not only the material but also the approaches.
The World Oral Health Forum exists to open up the question, to debate it, discuss it. To expect us to come to an absolute conclusion is not the purpose, but I think what is absolutely clear from this is that there is a clear call to action to leadership of NDAs and also to FDI as well.
David, thank you for joining us.
It's a pleasure.
For anyone that doesn't know, could you tell us what is the World Oral Health Forum? Who's involved and what's the purpose?
The World Oral Health Forum is one of the marquee events each year at the World Annual Dental Congress. So it exists to address an issue of current importance, one that the membership may not be fully briefed on, and it's usually one that has a number of important dimensions to it. It's not a simple open and closed yes/no answer, and we don't expect during the course of the session that all of the answers will be provided. We don't expect that the complete future agenda will have been mapped out, but it does become a stimulus and a challenge for future action.
And what was the main focus then of today's discussion?
So the focus of today's discussion is the Minamata Treaty. Now, the Minamata Treaty is led by the United Nations Environmental Programme, and the main driver for that, the principal focus that they have, is addressing toxic compounds, elements and materials in the environment and how to achieve their removal. And in this case, so the main thrust of the programme is to withdraw mercury from the environment.
That presumably is going to be a big challenge though.
It's a challenge, but it's also a great opportunity. I mean, the challenge part clearly is that there is a big burden of untreated tooth decay in the world. 3 billion people worldwide have untreated tooth decay, the biggest single chronic disease worldwide in terms of impact. And that can't just be ignored. So we have to find ways of treating that, and we have to think about how that will be done when we no longer have dental amalgam available. That, in a sense, is part of the challenge. The real opportunity is to say, okay, let's step back and think about how we could be more effective in preventing tooth decay. And I think we've had a really excellent discussion this morning that's looked across the entire spectrum in terms of its removal, its replacement, and how we find absolute alternatives to using it.
What implications is today's event going to have on policy?
I think what's been very interesting this morning is we've had an extraordinary level of interest from the audience. I can't remember a session like this when there have been quite so many questions, quite so many people queuing up at the microphone to be next in line. What I think I've taken away from this is that national dental associations now see much more clearly what their role is. Their role in terms of reassuring their patients that this is not a nasty problem, but it's completely manageable. But also it's clear that it's helped them in terms of mapping their agenda, in terms of advocacy and discussion making and having an intelligent discussion with policymakers, and also working with the clinicians in their practices and the universities in their countries to develop good alternatives. And it's also very clear that for FDI itself, the central leadership of FDI, I think it's helped to crystallise what the advocacy strategy there and the positioning of FDI needs to be.
What impact can this sort of global meeting have?
I think this global meeting, and using the word Oral Health Forum, I guess is the point, what it can do is reach the totality of world dentistry in one session. It doesn't require a whole series of different lectures in different cultures over an extraordinarily indeterminate timescale. I mean, we've had every table in the room full this morning in a big hall. As many people here this morning as normally attend a council meeting. That is phenomenal reach, and I think that's what meetings like this are able to achieve.
David, that's fantastic. Thank you so much for joining us.
You're very welcome. Thanks a lot.